Hello everybody, Dr. Agin here again with Q&A with Dr. A. So very happy that we've been getting a lot of good feedback from these conversations, whether they're at the live time or if there are people watching at a later time. Because there is a lot of information that I intend on sharing with you guys that you just aren't going to get the same information from most of the traditional doctors. And so a lot of this information and a lot of the ways that you can learn is to understand that, spending my whole career on out-of-the-box medicine or non-traditional medicine has given me the opportunity to really learn and appreciate all the different opportunities we have out there that a lot of people don't know about. And so over the last 3 years, obviously we've had a tremendous impact on our health, or at least attention on our health and our wellness, and of course our immune system with the whole pandemic. And I think it's really shed a lot of light on some of the things that we could be doing that we aren't doing, which is why some people had a longer duration and severity of COVID if they got it, or any viral illness, because frankly there was tons of viruses all this past 3 years that have been ignored, but they're all kind of treated the same way. And that starts with having a strong immune system. So we're going to talk about boosting your immune system, and there's a lot of things that we can do to achieve that, and there are a lot of things that people aren't doing that are very simple, very inexpensive, and that can make a big impact. So first and foremost, I'm going to start again with lifestyle, and you're going to hear me probably say this every single time we have a discussion, is because that is what powers our body, and of course immune system is no different. So that makes me start with the CarbRev program that we have, and it's a lifestyle program that was designed to really get someone started on the right path of creating a regimen or a lifestyle that's conducive to supporting the brain, supporting your immune system, and obviously getting the benefits of a good muscle to body fat ratio. And so in the CarbRev, it basically has everything to support the exercise, support your sleep, and then obviously it's a diet or eating strategy. So that's kind of where it starts, is you have to get good quality sleep, get into your deep stages of sleep and have a good sleep cycle. And just reminders, going to bed between 10 and midnight and getting up between 6 and 8 is the recommended sleep awake cycle. And then obviously eating strategy, we're going to, just intermittent fasting by itself, which is our core eating strategy in the CarbRev, has been shown to not only increase NAD levels, which we're going to talk about, which is super important for your immune system, but as we mentioned in some of the previous Q&As, was it also increases your brain-derived neurotropic factor, so it's also supporting your brain. And along with exercise, we talk about how interval training or cycling or not cycling like bicycle, but circuit training and then high intensity interval training. They're all kind of the same, and that's that boot camp mentality. So you get your aerobic and anaerobic at the same time. That has also scientifically been shown to increase NAD levels and increase BDNF. And so when we're talking about NAD, which is going to be my number one immune supporting therapy, it might not have been what you guys might have anticipated, but it is in fact that important. And so NAD is called nicotinic adenine dinucleotide, and it's a derivative of niacin or vitamin B3. And so we naturally create NAD in our bodies, but we also naturally diminish our NAD stores as we age. So it's just like hormones. Everything in our body starts to decline as we age, which causes aging. And so if you can imagine, people that age faster likely have lower levels of NAD, lower levels of hormones, which then start taking away and slowly deteriorating the body. And so what we're trying to do is what you probably all have heard out there, very common terminology called biohacking. Biohacking and anti-aging are one and the same. All that means is that we're trying to manipulate our internal environment and external environment to maximize our wellness. And so immune system is right intact with that whole concept of biohacking. And so NAD levels is something that we have to take serious, and we want to do anything we can to improve our NAD status, because NAD is essential in our immune response. And NAD has become a lot more accessible and a lot more of interest to non-traditional or functional medicine doctors because of the results that we're seeing using it. And so, so when we look at NAD decline as we age, and we already mentioned some of the ways you can increase NAD. So we naturally get various nutrients from our foods, which of course our diet is not rich in these foods as much as we need to. But when you get nutrients from our foods like B3, our body breaks that down and converts that into NAD. So at some point, as we're losing it with age and we're using it for our body's needs and we're not getting enough in our diet, people then can start coming into this what they call NAD deficiency. And NAD deficiency is what I feel is the root cause of a lot of chronic illness and especially autoimmune disease. But when I see patients that have just kind of always just seem sick, and if you look at their history, especially if they're not people that I had originally seen as a patient, but they came to me later trying to get some help with to obviously get healthy, you find that there's this interesting story that these patients have, that a lot of them have really never felt healthy. And that could be depression, anxiety, high blood pressure, autoimmune disease, which could be anything from lupus, celiac, Sjogren's syndrome, rosacea, inflammatory bowel disease, all these autoimmune diseases that they just never seem to get better. And that's despite all the medications and all the doctor's visits that they go to. They're still just not feeling well, and they're stuck in this vicious cycle. And so my safe assumption is that these people are not only suffering for potentially some hormone decline if it's with age, but even young people can burn up their NAD stores because they're constantly using their NAD to fight their diseases. And so if their body's always inflamed and they start to get into this vicious cycle where then they start gaining weight, they stop exercising, then their sleep is affected, they get put on pharmaceuticals which cause more micronutrient deficiencies. And you can see how this vicious cycle just keeps them in a position where it's very hard for them to ever feel well. So here comes NAD therapy. And so over the years, especially the last 6 years, we've been doing NAD infusions in our office pretty aggressively, and NAD injections for home use. And what we've seen is a tremendous response, even through for people that were suffering after they did get a severe case of COVID, would come see us 2, 3, 4 weeks after having the virus, and then still be suffering from post-viral syndrome, which can include a cough, it can include fatigue, it can include obviously this the loss of taste and smell. But so these people, now you got to think, they just went through a viral syndrome. They had to use up a lot of their NAD to fight this virus. They also, in a large part of our population, they have underlying disease before COVID, or they're over the age of 50, or they don't exercise, or they're overweight. And so you can see how this then becomes a big problem when you're already dealing with some sort of an NAD deficiency. So now we start giving them NAD, and next thing you know, within 24 hours, 12 to 48 hours, I'd say, you start seeing these people going, oh my gosh, I start having my energy again, I feel better. Some people are getting their taste and smell back. Sometimes that would be in conjunction with hydrogen peroxide IVs, which also helps with the immune response and fighting viruses. But it was really neat to just see how quickly they just sucked up this NAD and started to feel better. And so both for just immune boosting, I think NAD is the number one opportunity. But I think for anti-aging, we're going to see NAD becoming more and more on the front runner as far as anti-aging goes. All we really hear about with anti-aging is hormones, growth hormone peptides, testosterone, progesterone, and other vitamins. But I think you're going to see NAD is going to really take the top spot, and I think everybody needs it, especially after we get over the age of 35, or if you have any underlying disease. You just might need to build up your NAD stores so that you can actually have a fighting response for your immune system when it needs it. And so what I mean by that is that NAD directly also is a mitochondrial necessity for energy. So what it does is NAD plus is electron electron donor, and so that is donating electrons into the mitochondria to turn into ATP, which is our energy. And so, we need it for energy, and you can imagine if our bodies are using up all our NAD for the immune response, if we have chronic illness or if we get sick, then of course you're going to be fatigued, and then that leaves people tired, and then tired turns into depression, and you can see how this all goes. So that's about NAD. We have a lot more about NAD on our site as well if you want to find more information. But now I'm going to go on to the second one. And so we talked about lifestyle, we talked about NAD. Another one that's really important is called BPC 157, or Body Protection Compound 157. It's another one that I've had the luxury of having a lot of experience with personally. I think some of you remember I just had my shoulder surgery. I've been taking BPC daily since I've had it before the surgery and now after. I'm recovering really nicely. I had my first PT session today, but I'm already, that's pretty good range of motion. That's about as far as I can go, but I'm minimal pain. I've only had to take 2 Motrins, no pain medicine since my surgery. So I do think this is a great anti-inflammatory an immune modulator that works really well. And so what BPC is, it's actually made in the gastric cells of our stomach. And so it's really important. It's a natural compound, but they found that it really supports connective tissue, reduces inflammation, and supports our immune response. And so it's really heavily used for pre and post surgery and for connective tissue injuries. But what we're finding is that BPC, because again it's body protection compound, has been very noted for what it can do for your liver health. And obviously our liver is is the detoxifying organ in our body, and very important for our immune response, if not one of the main responses for our immune system. And so when you have BPC and you can start rotating that in with NAD, or depending on your resources, alternating them, I think both of these are really good, simple opportunities for you guys to really see an improvement in your immune function, but also looking at how that's going to be that biohacking and really work for anti-aging as well, giving you energy and helping power your mitochondria, which we're going to need obviously as we age. And then that takes me to also consider, there's a couple other therapies that we have that I know are really good. One of them is a nutrient injection that has methionine, inositol the B vitamins, and also has a vitamin C. And so these are all, again, very good supporting nutrients for our immune system, because we just don't get enough of this in our diet. You really have to be on top of your, getting either some super greens or super reds, because we just don't get enough fruits and vegetables in our diet to get a lot of these nutrients. And so, so just make sure you are supplementing very well. And just remember, nutritional supplements are no longer a supplement to a good diet. They're a requirement, because we just need them that much. So this is a nutrient injection, and why it is important is because we're bypassing our gut. And as you can imagine, with the unhealth of our society, specifically gut health, when we're talking about being overweight and obese and eating a lot of processed foods, our incidence of diabetes, which we talked about in a previous Q&A, these things all are affecting our gut. And I think that at this point, we can assume that gut disease is, or at least deficiencies in our microbiome, which are all the components of these organisms that really manage in our gut and manage all the foods and nutrients we eat, that gut health, or I should say gut disease, is an epidemic. I mean, we should just know that a lot of the supplements in capsule form or pills that we take, sometimes we're not going to break them down and absorb them. That's why I like injections, because we're bypassing the gut and we can actually get 100% absorption versus questioning what our motility and absorption is going to be in our gut. And so kind of spinning off of that, that brings into the whole idea of the skin and our innate immune system that really centers around our gut and that microbiome. And I'm sure everybody's heard people talking about the importance of our microbiome, but that is a huge part of our immune system, and we don't really understand just how important our gut is in making neurotransmitters for depression and anxiety, but also our immune response. And so although we don't have a really good probiotic or prebiotic that we make, that is another one that everybody should be on. Try to make sure you're getting a lot of the prebiotic fiber. You're supposed to have 25 to 30 grams of fiber in your diet per day. I can tell you that probably 95% of the population does not get that. So either getting some psyllium husk, or like I said, get some super greens that take all the phytonutrients out of the vegetables and put them in a powder, so that you can get some of these necessary nutrients and also feed your microbiome. So the healthier and happier your gut, the healthier and happier you will be. We also have lysine that I know is a good one that you can use for injection also. Lysine is very important for our immune function. I know, and we previously had thymosin alpha. That one got taken away during the COVID time because apparently it was actually helping people with COVID. So the government banned thymosin alpha for some reason. We really don't know why, but all of a sudden, boom, you couldn't get thymosin alpha, which is a direct immune modulator, improved our natural killer function, worked right on our T cells to actually improve our immune response, which is why it was helping on post-viral syndrome and the current in an acute viral syndrome. But the good news is that we have now found out that one of the pharmacies is going to make Thymulin. That's Thym, is in Mary, Ulin. And what that is basically it's a combination of thymosin alpha and thymosin beta in one injection. And the dosing is going to be pretty neat because you don't have to take it continuously. It'll be either a 2-week, 4-week, or 3-month dosing cycle, but that is going to be really nice because I think until everybody can get their lifestyle intact to where they're really pushing their own natural production of NAD and brain-derived neurotropic factor, and so that they're kind of strengthening your own internal and innate immune function, that this would be an important one, especially during the flu seasons, is to have something like we did when we had thymosin alpha. So that is really exciting that Thymulin we should have that ready to prescribe within 2 months. And I am super excited about that because I was a huge fan of thymosin alpha. We would put it in our immune bags here when we did infusions, and it really did help a lot of people out during COVID. So, even if you just kind of keep that on your radar for the flu season, and the rest of the time you're working on the little things that are important. So that kind of takes you through a lot of the products that we have specifically for immune boosting. But again, I'm going to go back to the basics again and just say you got to start your foundation with sleep, diet, and exercise. I can't stress that enough. And if you're really having a hard time getting your regimen going, start with a carb rev. Do it for 3 months. The carb rev has a morning shot. It has a fat burner that has beta hydroxybutyrate, which is a ketone. It's based off of intermittent fasting. It has a Mind Drive, which is a nootropic. Spent 2 years working on that product. It is a very, very powerful mood enhancer and memory and focus enhancer. And then you have a nighttime formula to help get you into the deeper stages of sleep, all based around intermittent fasting. And so, in 3 months of that, if you are following it, 90% of the time, you're going to have yourself in a completely different health category than you did before starting it. Because the most important thing is you have an eating strategy that you can continue for life. I've been doing intermittent fasting for 8 years now. And 2 is you're going to be restructuring your sleep cycle, improving your stages of sleep, reducing body fat, increasing lean muscle mass. So if you're really trying to just get started, start with that. For those that are already kind of in a good position, but really looking for the best way to, I think, improve overall wellness, then I would start with NAD. If you're looking for the most important product that you could start with, some of these are a little bit of an investment, but again, remember, if people think that this investment isn't worth it, you are your biggest asset. And remember that if you think wellness is expensive, try illness. And I think that is the thing I'm going to keep telling you guys all the time, is that if you invest in yourself and you get yourself feeling strong mentally and physically, everything else is going to make sense. You'll have a chance to spend money on other things, but they're never going to be as important as spending money on yourself. So again, start with the basics: sleep, diet, and exercise. Another one that's important around the holidays is that, is alcohol consumption. And, you just have to understand that as we age, especially, every time you drink and you drink excessively, it affects your microbiome. drastically affects your gut health. And it's a depressant, and it also has empty calories, and it will also affect your deep stages of sleep. So you can see that it really does nothing good for you other than leave you a little bit happy into a certain point, and then obviously it goes downhill once you go over the hump. So just be careful on your alcohol consumption. If you're going to drink, try to drink early. Try to make good alcohol choices. Clear liquors with club soda or water. You don't use the sugary mixes or getting into these sugary drinks because you're looking at, one, having too many calories, two, you're looking at a hangover and obviously disrupted sleep. So a glass of wine, a cocktail, especially if done before, I would say 8 or 9 o'clock in the evenings. I know it's the holidays, so some days it makes sense for you to maybe consume a little more than normal. But again, this is, moderation is everything. So just understand that and realize that everything you put in your body does affect your immune system. And so that was a pretty good roundup on our products that we have and some of the things that I do and have my patients do for both boosting their immune system. But the best thing is it starts with lifestyle, which is free. And if you need a start, just remember the Carb Rev. And then if you haven't tried NED, I highly recommend it, or BPC 157, and then any of the nutrient injections. So everyone have happy holidays. I will see you next week, and I'm sure we'll have a wonderful topic for you guys. And then at least have a happy Christmas. Merry Christmas.